Hi, good afternoon. My name is Terika Thomas Mills, and I'm going to be demonstrating IV fluid and med administration. I'm going to start off by performing my hand hygiene, and then I'm going to apply my gloves. So I have gathered my supplies. I have my primary fluid. I have verified the provider's orders in the MAR. I have verified the 6 right of med administration. I have verified I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. For our primary tubing, I have a Macodrip drip set that is gonna be running at 15 drops per ml, and I have my piggyback, my amoxicillin. I have my amoxicillin, I'm sorry. So the doctor has ordered this medication 250 milligrams, but it is supplied in 100 milligram, and this is to run over 15 minutes. So the piggyback is supplied in 100 milligram, and it's to be supplied, it is to run over 15 minutes. So I have also verified the 6 right of med administration for this medication. I have verified I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I have also verified that the patient doesn't have any allergic reaction to this medication, and I have also checked in his chart to ensure that he's not allergic to this medication. And for this, I have my secondary set, and it's my secondary set, and that is also Macodrip at 20 drops per ml. And I also have my alcohol prep pad, and I have my piggyback hangers here. So I'm gonna start off by doing my calculation for my fluid. It's gonna be 150 ml. That is to be supplied over a period of 1 minute, and the flow rate, over a period of 60 minutes, and the flow rate is going to be 15 drops per ml. And with that calculation, it's going to be 37.5 drops per minute, but we normally round up, so we're going to have 38 drops per minute for this one. And for the amoxicillin, this was ordered at 250 milligrams, and which is supplied in 100 milligrams 100 milliliter over 15 minutes. And it's gonna be our marker drop rate is at 20 drops per ml. So with that calculation, we're gonna have 133 drops per minute. Okay, so next I'm gonna start by priming my primary infusion. And for our tubing, for the primary tubing, so here I have the spike end, and this end, this is what is inserted in the bag, so it has to remain sterile so as to not to contaminate the medication. And here we have the drip chamber, and this is what prevents air from entering the tubing, and it also allows us to visualize or flow rate. Here we also have our roller clamp, and this is what allows us to like regulate or adjust our flow rate for the medication. And we also have to ensure that we start off with this in the off position. Next we have the Y-site, and this is what it used for medication administration via IV bolus or IV piggyback secondary infusion. And finally we have the adapter end, and this is the end that is connected to the patient's IV site. And yes, so this is the end that is connected to the patient's IV site. So I am gonna spike my bag. I have to first start off by removing this cap from the fluid. Next, I'm gonna remove the top of my spike, and then I'm gonna spike my bag. Okay, so since I know that I'm gonna be doing a piggyback, then I am gonna hang this up. I'm gonna hang this on the lower. I'm gonna hang this lower. Okay, so the next thing, I am gonna have to prime my line, and in order to prime my line, I'm gonna squeeze my drip chamber until it's half full. And now when it's half full, I am gonna slowly open my roller clamp, and then I'm gonna open it until the fluid runs all the way through the line, and there is no I have to ensure that there's no air bubble in it. Okay, next I'm gonna turn it off. I'm gonna close it, and I am gonna use my alcohol pad, and then I would clean my adapter end. And after I clean it, I would allow this to dry, and then this I would attach to the patient's attach it to the patient IV site. All right, so the next thing I'm gonna do, I'm gonna slowly open my roller clamp so I could set my infusion rate. And for this primary, it is supposed to be 38 drops per minute. So I am gonna count for 1 full minute and verify that I have 38 drops per minute. Okay, so I'm gonna open. All right, so I'm gonna be counting for 1 full minute. Okay, so I have counted for 1 full minute, And in the real world, I would allow this infusion to run, but due to limited supply, I'm gonna pause it. All right, so next I am gonna prime my secondary line, and this is gonna be running at for this it's gonna be running at 20 drops per ml. So I am gonna do the same thing. I'm gonna remove this, and then I'm gonna open the spike, and then I'm gonna go ahead and I'm gonna spike my bag. And of course I'm gonna make sure that the line is closed. And I am gonna hang this above my primary bag, and I have to ensure that both my amoxicillin and my primary fluid is hung at least 30 inches above the patient's IV site. Okay, so for this one, I am gonna squeeze and my drip chamber until it's half full, because I'm gonna have to prime the line. So I'm gonna squeeze my drip chamber until it's half full. Okay, and I am gonna slowly open my roller clamp so I could count my my drip rate. I'm supposed to have 133 drops per ml. So I'm gonna slowly open it, and then I'm gonna allow my medication to run through the tubing and ensure that there are no air bubbles. Okay, so now that the air bubbles have been removed, I'm gonna close my line. Okay, so now so now that I've primed my line, I am gonna go ahead and I am gonna count. I'm gonna use my alcohol pad, and then I'm gonna clean it. I'm gonna clean my white tubing. I'm gonna clean my Y area. And then I'm gonna wait until it's dry. And then once it's dry, I'm gonna remove the top, and then I'm gonna connect my medication. Okay, so now that I've done that, I'm gonna go ahead and then I'm gonna open the roller clamp to my medication, and then I am going to count, slowly open it, and then I'm gonna count my drip rate, and I am supposed to have 133 drops per minute. So I'm gonna go ahead, slowly open, and then I'm gonna go ahead and count for 1 full minute. Okay, so I have counted that the drop rate, and we actually have 133 drops per minute. I am gonna go ahead, I'm gonna double check my patient's IV site. I'm gonna look for any signs of infiltration, any swelling, and any redness. And if this happens, then normally we would turn the infusion off. And since amoxicillin is a moderately high risk medication, I'm just gonna stick around for a minute to see if the patient experiences any signs of hypersensitivity or any forms of hypersensitivity reactions. Okay, so the patient seemed to be okay. He's tolerating the medication properly. So I am gonna go ahead and position my patient in a position of comfort. I am gonna gather my supplies, and then I am gonna remove my gloves. I'm gonna perform my hand hygiene, and then I'm gonna go do my documentation.